dental surveyor. Before going into the topic, let's talk about history. Let's move back to early 20th century. During that time, we use arbitrary method in that we hold cast at certain distance from the arm and observe the undercuts. In order to make it simple, a mechanical device to determine the relative parallelism of tooth surface was first employed by Dr. A.J. Fortunati in 1918, and the first company to manufacture is J.M. Nace Company. So what is dental surveyor? Definition: a paralleling instrument used in construction of dental prostheses to locate and delineate the contours and relative position of abutment teeth and associated structure. Let's move back to type of surveyors. There are three types: Nace surveyor, Will surveyor and William surveyor. In Nace surveyor, horizontal arm is fixed, and in Will surveyor, horizontal arm is movable, and in William surveyor, horizontal arm is split and jointed. Let's talk about parts of surveyor. We have surveying platform, which is a metal base parallel to the floor onto which the cast holder and vertical arm is attached, and vertical arm. And then we have horizontal arm, which extends at right angle to the vertical arm. And then we have surveying arm. It can be moved vertically up and down. In surveying arm, a mandrel is attached. In surveying platform, a surveying table is placed. It has two parts, base and cast holder, and the holder is attached to the base with ball and socket joint that permit cast to be oriented in various horizontal planes. Let's move on to surveying tool. These are held by the mandrel attached to the surveyor arm, and the tools are analyzing rod, carbon marker, undercut gauge, and wax trimmer. Analyzing rod. It is the first tool used in surveying. It is a cylindrical metal rod that contacts the convex surface of the tooth to be analyzed like tangent contacting the tooth by locating the contours. It is used to determine the relative parallelism of one surface to another, and these are called as paralleling tool. It makes initial assessment to the path of insertion. Let's move on to carbon marker. It is similar to lead points in lead pencil, used to draw survey lines by contacting the tooth surface, similar to analyzing rod. It denotes height of contour. In cross section, in Nace surveyor, it is circular, and in Will surveyor, it is triangle. Then let's move on to undercut gauges. The undercut gauges are used to measure the depth and location of undercut on the analyzed tooth in 3D. It consists of vertical rod attached to the center of the circular metal plate, while the vertical rod contact the height of the contour and the circular projection contact the undercut. It comes in various sizes. These are, it is 0.010, 0.020 and 0.030 inches were available. Let's talk about wax trimmer. It is used to trim excess wax from blockout areas and make them parallel to the path of insertion, and also used to trim waxed crown restoration to desirable path of insertion. Let's move on to uses of surveyor. The surveyor is used to survey the diagnostic cast. It determines the path of insertion and removal of cast partial denture by establishing the guiding plane, and locate and measures the undercut for mechanical retention and identify the hard tissue and soft tissue interferences. After surveying, the establishment of formal designs of RPD can be done. It is used for the placement of intracoronal retainers, and for the placement of internal rest, and for machining the cast restoration, to survey the master cast, and to contour the wax pattern, and to survey the ceramic crowns. So what are the procedures in surveying? Step 1. The cast is placed on the surveying table with the occlusal surface parallel to the horizontal plane, and the anterior part of the cast should always be faced towards vertical arm. Step 2. Tilting the cast. The tilting can be anterior tilt, posterior tilt, or lateral tilt. After tilting, step 3 will be placing analyzing rod, a cylindrical metal rod, To determine the relative parallelism of one surface to the another, these are called paralleling tool. It makes initial assessment to path of insertion. Step 4, using graphite marker. By using graphite marker, survey lines were drawn on the surface of the tooth surface and it denotes the height of contour. Step 5, replacing the graphite marker with undercut gauges. The undercut gauges are used to measure the depth and location of the undercut. Step 6 will be removing the interferences. And step 7, tripoding can be done. After that, necessary mouth preparation are carried out. So, the surveyor is an essential tool in the diagnosis and treatment planning of removable partial dentures. Surveying helps in designing a removable partial denture such that the rigid and non-rigid components of the prosthesis will go on into the mouth as a single unit, free from interferences, and in the mouth will resist dislodging forces.